trusted, live and local from the downtown Canton studios of WHBC.
Day 2 of Healthcare Week as we come to you live today from OMNI Orthopedics here at Belden Village. Off of Belpar, and John Bozico along with you. Going to be another day of interesting discussions today from the start of the show until the end, as we have a number of different doctors and nurses and different individuals in the healthcare field who are going to stop by and make today an interesting show for myself and for you, the listener. So first we bring in Dr. Anthony Pentz. He's a board-certified orthopedic surgeon specializing in adult reconstructive hip and knee surgery. So, Dr. Pentz, thanks for joining me.
Great to be here with you.
So, you and I were talking before we went on air here this morning, and I was saying, well, I remember my grandmother when I was like 5 or 6 had a hip replacement, and I remember that it was a very lengthy procedure and that she was bedridden for a while, and you were telling me that 3 hours after a hip surgery now, you're having people up and walking again. So my first question to you is, what's changed in technology so much in the last 20 years that's made that possible?
Yeah, I've been doing this for a lot of years, and I've just seen radical changes. And even being in the medical world, if you would have told me that we're able to do joint replacements as outpatients 7-8 years ago, I would have told you that's impossible. The big things that we've changed is the techniques that we use to implant the devices that take your pain away. And then our anesthesiologist colleagues have brought a lot to the table in terms of pain control. In the bad old days, we do these joint replacements, and the patient would go up to their room and they'd be largely bedridden with a bladder catheter in with what was called a pain pump, where literally they would give themselves pain injections every 7 to 8 minutes. Now what we do, we give a local anesthetic that really blocks most of the pain signals. And then every place I as a surgeon work, there's a slow release pain medication that I can infiltrate the area with, and it lets you have the function of the joint without the painful response. So not only do you avoid the heavy narcotics that give you constipation, that don't make you want to get out of bed, the other thing it lets you do is form a good relationship to your new joint. So several hours after surgery, we have you up, your mind, whereas in the bad old days, your mind would view this as an injured part that you didn't want to use. Now all of a sudden your mind realizes this joint works, it's not painful, I can trust it, and lo and behold, we're up and out of bed.
It's a brand new part, and all of a sudden you have less pain. And that's interesting that you're saying about going away from using as many painkillers as there have been in the years past. Is that due to some of the ongoing opioid crises that we've seen?
Well, clearly, too, that was a pressure that we felt. And then, like I said, the new pain control technologies really have evolved in the last 5 years, where we're using pain blocks. And this new medication just came out probably about 4 years ago now that lets us infiltrate where we do our work. And the procedures themselves are less disruptive than they used to be. People hear about minimally invasive. We started the minimally invasive hip here in town probably about 8-9 years ago. And people always equate that to incision size, but I explain to the patients the cosmetics are important, but more important to me is internally we're not taking down ligaments, we're not disturbing bone structure as much as we used to, and those things we're disrupting less, and so that's a good thing for the patient.
So what you guys have done here at OMNI is we're joined by Dr. Anthony Pentz. He's integral in replacing hips and replacing knees. All different types of things here at OMNI Orthopedics on Belpar. What have you guys done then to advance as a whole, here at OMNI, and specifically to what you guys do here? How are you guys maybe more advanced to somewhere else that's doing these same things?
Yeah, I would point, we've got that new building going up that is going to be a dedicated surgery center and pain management center. All these things that I've been sort of talking about are going to coalesce there, and we're going to have really state-of-the-art for these outpatient joint replacements. I think you're going to have Lisa Hazen. She's one of our nurses and just has done a great job to coordinate this program, because clearly when you're doing these joints in this outpatient environment, you got to do your homework at the front end, and you got to oversee the person as they go through the process, so that they come in armed with knowledge. We prep the patient with what we call, everyone's familiar with rehab. Now we prep the patient before they ever get to the operating room with something we call prehab, so that they're tuned in to the exercises, their muscles and tissues are prepped. Lisa teaches them a ton of how they're going to help themselves through this process. In the bad old days, we used to almost view joint replacement as a sickness, and it's not really. You're a healthy person with a bad part, and it's really been a sea change in how we look at joints. You're not a sick individual, you're a healthy person with a bad part. Let's keep you healthy, let's keep you out of the hospital, and let's let you get on with your life.
Keep hearing you say the bad old days. Is
Yeah.
that what that's called? Is that so? Is that like what medieval times were then? Like when you still use leeches to get things and stuff like that?
No, I mean, like I said, I've been doing this for 30 years, so I've seen so many changes, but it's just amazing how the philosophy has evolved, how we approach patients. And, we've really made the patient our teammate, and Lisa just does a great job with that. I think Dr. Stonestreet's going to come in and talk to you a little bit about the robot, and that's a fantastic thing that is, I think, we're going to see more and more of. So there's a lot of exciting new things. The technology just keeps evolving in a good way.
Last thing I want to ask you here, with the ongoing pandemic that we've had, how has that affected what you've done, and how has that affected in your department what OMNI has done, and why should people feel safe coming to have a hip replacement at OMNI?
And one patient, put it the best way when we were scheduling a joint replacement: if this were your family member, would you do it at this time? And I reassured them, and I think a visit here would be reassuring to anyone that they realize that we're, I think, doing all the right things in terms of taking precautions, the screening questions, the temperature, the restricted flow through the office between each patient visit, either in therapy or in the office end of things. We're wiping down the rooms. Our staff, I'll give them a shout out. I think they're second to none in town. They really care about people, and I think it's reflected every day when you come through the hallways here.
Dr. Anthony Pentz, he is a board-certified orthopedic surgeon specializing in adult reconstructive hip and knee surgery. And Dr. Pentz, I thank you for your time. I still can't get over the 3 hours thing when it comes to getting back on your feet. I don't think any of us here
It's a different world.
It really is. I mean, that boggles my mind that's how far we've come. But thanks for joining me.
And thanks for being here. I appreciate you putting the word out and involving us.
Absolutely. We'll take a break. We'll come back, and we'll be joined by Lisa Hazen. She is a registered nurse and the total joint nurse at OMNI Orthopedics. So she's a total joint nurse at OMNI Orthopedics. Lisa Hazen, when we come back.